Warm greetings from the Nepal Cancer Education Foundation, Kathmandu. Today I will be presenting on radial ellipse segmentectomy, a surgical technique commonly used in breast conserving surgery. And the first documented case of radial ellipse segmentectomy is simple oncoplastic breast conserving surgery in Nepal. Breast cancer remains one of the most common cancers worldwide, and advances in surgical techniques have focused not only on effective tumor removal but also on preserving breast appearance and function. Radial ellipse segmentectomy is one such technique that balances oncologic safety with cosmetic outcomes, especially in selected patients. Radial ellipse segmentectomy is a breast-conserving surgical procedure where a tumor is excised along with a surrounding margin of healthy tissue. While versatile, it is particularly well suited for lesions in the upper outer quadrant, especially those away from the nipple areola complex. It provides easy access to the axilla for sentinel lymph node biopsy, which is often performed alongside tumor removal. The key feature of this technique is that the incision is made in a radial orientation, meaning it extends from the tumor toward the nipple, following the natural ductal pattern of the breast. The excision is shaped like ellipse, which helps remove the tumor effectively, maintain breast contour, facilitate easier closure. This procedure is typically indicated in early stage breast cancer, tumors located in a position that allows radial excision, patients who are candidates for breast conservation, cases where cosmetic outcome is an important consideration. It is particularly useful when the tumor lies along a ductal line. The lesion is relatively small compared to the breast size. Let's walk through the surgical steps. Step 1. Preoperative planning. Imaging such as mammography or ultrasound is used to localize the tumor. Marking is done on the skin, aligning the incision radially toward the nipple. Step 2. Incision. A radial elliptical incision is made over the tumor. The long axis of the ellipse is directed toward the nipple. Step 3. Tissue excision. The tumor is excised with a margin of normal tissue. The shape of the excision is elliptical to facilitate closure. Care is taken to allow the natural ductal anatomy. Step 4. Margin assessment. The specimen is oriented and sent for pathological examination. Ensuring clear margins is crucial to reduce recurrence risk. Step 5. Closure. The wound is closed in layers. Because of the elliptical shape, closure usually results in minimal distortion. Coming to our case report, a 29-year-old patient with early breast cancer in the right upper outer quadrant away from the nipple areola complex was treated with a radial ellipse segmentectomy over 15 years ago. During surgery, methylene blue was used to mark the tumor margins, followed by lumpectomy and sentinel lymph node biopsy through the same incision. 2 lymph nodes were removed, including one stained node. The procedure concluded with careful tissue and skin closure. The patient had an uneventful recovery with excellent cosmetic results and minimal scarring. After more than 15 years of regular follow-up, she remains well. This is reported as the first documented case of radial ellipse segmentectomy in Nepal. Radial ellipse segmentectomy offers several benefits. Better cosmetic outcome due to alignment with breast architecture, reduced deformity after healing, efficient tumor removal with adequate margins, good healing due to tension-free closure. Despite its advantages, there are some limitations. Not suitable for large tumors relative to breast size, requires careful planning to avoid nipple distortion, may not be ideal for centrally located tumors, requires surgical expertise for optimal results. Compared to other breast conserving techniques, radial ellipse segmentectomy aligns better with natural anatomy than transverse or circumferential excisions. It generally results in less cosmetic deformity than non-oriented excisions. In conclusion, radial ellipse segmentectomy is an effective and cosmetically favorable technique in breast conserving surgery. By combining oncology safety with aesthetic preservation, it plays an important role in modern breast cancer management. Careful patient selection and surgical planning are essential to achieve the best outcomes. Thank you.